Good afternoon, everyone. It gives me immense pleasure to introduce Dr. Divya Jagadeesh, accomplished optometrist whose career journey is truly inspiring for all of us in science. Dr. Divya completed her Bachelor of Optometry and Vision Science from Lotus Boshanlam Institute of Optometry, affiliated with Bhagapati, followed by her M.Phil in Optometry from Elite School of Optometry, affiliated with BITS Bilani. She later her Golden Vision Institute and UNSW School of Optometry and Vision Science, where her research focused on predicting models for incidence and progression of myopia. Her professional experience spans clinical optometry practice, research, academia, and ophthalmic industry. She has worked as a research officer with Professor Fiona Stapleton at the Center of Eye Health and State School of Optometry and Vision, postdoctoral research fellow at Brian Holden Vision Institute. Currently, she is working as a clinical application specialist for ZEISS, specializing in advanced technology for corneal refractive surgery. What introduction, even more special for me, is that my classmate during our undergraduate days, and I feel incredibly proud as I see her achievements and contributions to the field of optometry. Please join with me all in warmly welcoming Dr. Divya Jagadeesh. I will welcome you, Dr. Divya Jagadeesh, ma'am. Over to you, ma'am.
Hello, everyone. I hope I'm audible. Am I audible to you all? Yes? Okay. Thank you so much, Gauri, for introducing me. So as Gauri said, we both go way back. So we did our bachelor's together in Lotus Boshanam School of Optometry, Coimbatore. So thank you for introducing me, Gauri. It's a pleasure to be here talking to you all. And I'm not sure if is Shamala included as well in this call, or I'm not hearing anything. So thank you, Shamala, as well for organizing this. So when we three, like Shamala, Gauri, and I, we exchanged a few emails and also spoke on phone, and we were just thinking on deciding on the topic on what to talk. So Gauri was suggesting that it'll be a good idea to talk about different professions that students can take up after completion of their optometry course, be it undergraduate or postgraduate. So I'm basically just going to talk about my professional journey, starting from bachelor's up until now. So it's titled Bridging Optometry and Advanced Vision Technology. So which is where I'm standing today. I worked with vision technology. I work with a company called ZEISS. So ZEISS has its branch in India as well. And I'm going to talk about basically the professional journey and the titles I've held. Now, having said that, I feel like I'm still learning. So each day is a day to learn something new. So I'm still learning, and I'm just sharing my experience with you. That's all. I'm working as a clinical application specialist now for refractive lasers at ZEISS. So that's my role. Okay. So when we were discussing, we as in Shamla, Gauri and I, when we were chatting, so I think Shamla emailed saying that they require 5 questions because this talk will carry some level of like continuous education points for you all. So I thought let's keep it like very broad and not very technical, although I have planned to talk some level of technical stuff here as well. So I've kept it very broad though. So based on what we discussed, so the career opportunities and how you navigate your career when life brings changes in your life. So pretty much that's what we'll see. And hopefully during the talk or after the talk, you may think about these questions. So let me read out the first question. So how can optometry degree open doors beyond traditional clinic practice? And I think you might know already, like it's basically like apart from your clinical optometry, you can venture into other areas of under the vision space as well. So you know this already, but we'll talk a bit more about it. And I will share about a little bit about my mentors who helped me shape my journey and how optometrists can bridge that gap between clinical practice and now the kind of technology that we have in terms of the vision space, under the vision space. So we can talk about that a bit. And so being a woman, like my personal experiences did influence a lot for me to choose certain career path. So we can chat about that. And what impact can optometrists have? Now, this is not direct impact. When you're in the clinic, you have a direct impact with the patient, on the patient. But when you're not in a clinic, when you're doing research or other stuff, you don't have a direct impact, but you do transform patients' life. So that's what we do as optoms. So we can talk about this in the upcoming slides. That's pretty, that's my professional snapshot. Okay, so this like it's me put together till now. So I'll just go through pretty much. So these are the logos of institutes that I've been either working directly in or have done collaborative projects with. So I started off at Lotus Bausch and Lomb Institute of Optometry. So this is where Gauri and I did our bachelor's together. And this was a good place to learn in terms of they had different branches. So I remember when we were studying, they had 4 branches. And we had some really nice mentors, they were very insightful role models, and with the kind of population that we have in India. I remember, like by the time we did our internship, so we were supposed to maintain a logbook. I'm sure you're all maintaining that. So in that logbook, I remember like when we did, after I did my internship, my last day of internship, I counted the number of patients and it was like 3,500 odd patients that we saw. So, and it's plenty for an intern to see those many cases. It's a good opportunity, right? So that's the perk of being in India or in a country like India where we have a lot of population. So for example, China. So you see a lot of patients and therefore a lot of conditions and therefore you have good exposure. So that's the perk. And after that, I wanted to go back to my hometown for a bit. So I went back to Kerala. I'm from Kerala. And I worked in a hospital. It's called Abate. It's a good hospital, an ABH accredited hospital, had good leaders there and good support staff there. And I was working as a clinician there, but I thought I should do a post-graduation course. I should undertake a course of post-graduation. And I was still in touch with my seniors back in at Lotus. So I checked with them. I called up a few who did their masters or M.Phil and checked with them as to what they did and how can I prepare. And they advised me based on their experience. And I was preparing myself to go to Shankar Nethralaya or Elite School of Optometry because they all had very high opinion about this institute. And I prepared for my entrance and fortunately cleared the entrance and got into Elite School of Optometry, which is Shankar Nethralaya, managed by Shankar Nethralaya. And this was a very, I think, one experience that I would not like to take away from my life because it's very a career, like path-changing experience. So it's mostly Shankar Nethralaya. I think when you read about Shankar Nethralaya, it's revered as, or near its logo, it's revered as Temple of the Eye. So when you work there, when you step into that institute and you observe optometrists there or like performing different techniques or any ophthalmologist or anyone working there, you feel like they consider work as worship and it's just like temple of the eye. So when you see people working like that with utmost devotion, you feel like working more and giving your best. So I did my M.Phil there. I was working on a project on scleral contact lenses. And so during this time, M.Phil is also a research course, right? So it's clinic plus research. I was getting trained on contact lens specialty, so specialty contact lenses, scleral RGPs, etc. Plus, there was a research project that I was working on with my mentor. Her name is Dr. Rajeshwari Mahadevan, and there's plenty of work that she's done in terms of clinical research or pure research articles that's out there. And she is an institution herself. There's so much to learn from her. So, and then after I finished my M.Phil, I was looking for opportunities to work in research. And luckily, there was an opening at L.V. Prasad Eye Institute for a role. It was a research optometrist role in the pediatric strabismus and neuro-ophthalmology clinic. I worked there for a couple of years. Again, this is another exemplary institute that you can work in. So lots of learning from this institute, lots of good mentors there, lots of good colleagues there. And from there, so they have continuous education on a very regular basis. And one day, we had an opportunity where we had Professor Brian Holden visiting us. I'm sure you might have heard of Professor Brian Holden when you read about optometry or anything vision related, because he has immense a number of patents and products under him. So silicone hydrogel contact lenses was primarily done at, I think, Brian Holden Vision Institute, and he's one of the key KOLs for this silicone hydrogel invention. So Professor Brian Holden, he gave a talk, and then it went on for like, I think, more than a couple of hours or more than that. And at LVPI, they had this big auditorium where all the lectures happen. And so after his talk, it was a very thought-provoking, insightful, and very, very good talk about myopia, the research gaps and current research, etc., everything about myopia. So at this stage, after the talk, pretty much everyone wanted to do myopia research because the talk was very compelling. And then everyone, I think we all, like all of us there working, we were chatting that, oh, it'll be good to have a chat with him, like in-person chat with Professor Holden. And I remember like walking down the stairs and then like fortunately bumping into him and then having a chat with him. And I said, your talk was amazing. I'd like to work with you. I want to do PhD. And then can you be my supervisor? And then he said, write to me. And then I applied at the University of, applied to UNSW, University of New South Wales, Sydney University, and got through. And so that's where I did my PhD. And after that, I did my postdoctoral research in the same institute, so BHPI, for a year, all under UNSW's umbrella, and did a postdoc at UNSW and then to ZEISS. So this is a collaborative team that I worked with during my postdoctoral research. And so is this one during my PhD research. So with China and with universities in the US. So that's the snapshot. Now, if you have any questions, I don't know how it works. So are we doing it at the end? I'm happy to do it at the end.
It's Divya, hi. It's usually at the end.
Hello.
If there's anything compelling, I'll ask them to interject in between. Is that okay?
Yeah, totally.
Saranya,
That's
Thank
totally
you so
fine.
much. Thank you so much for agreeing to do the entire series with us.
Oh, is this Sharon? Is this Shamla?
Yeah. No, this is Saranya here.
Okay. Hello.
Hi. And a wonderful journey. Really nice to listen to that.
Thank you, ma'am.
Yeah.
Okay, I'll just continue then. So, yeah, so that's pretty much like where the institutions that I've worked with and the collaborative institutions as well. And it's just for the sake of this talk. So for example, I just copied and pasted this from my CV basically. So this is just for you all to see, like basically different titles that you can hold. Like once you're an optometrist, you're doing your research. So I was working as a research assistant, a teaching assistant. You can be a research optometrist, a research officer. I briefly worked as a science communication fellow. So it can be many titles that you can hold. And I feel like personally, like everything is learning, and then you learn throughout your life. That's all how I take it as. And wherever your life takes you, so based on that situation, you make a choice. That's how I think it as. Okay, so now with this, okay, let me move on to my next slide. So I'm going to talk about my PhD research next, but I can't do that without thanking my mentors. So there are a lot of mentors, actually. It wouldn't fit in this page because I look up to a lot of people. I admire a lot of people, and most of them are women. But then I do admire a lot of optometrists, ophthalmologists, and researchers and academics whom I've seen during my career trajectory. I will start with Raji ma'am. I can't include all of them, but I'm just going to talk about these four. But I'm very thankful to everyone. So Raji ma'am, we call her Raji ma'am. She's no more. She passed away a few years ago. She was an amazing mentor. She is an institution by herself. She's a very good clinician, an exemplary researcher. She was a good speaker. And the thing about her was that there were a few of us doing M.Phil under her in the contact lens subspecialty. So in the clinic, she'll be like, "Oh, this is how you do it," and then it's all like going by rules and things like that. And then like if it's a Friday evening, she will take us to a home, and then cook nice vada and all of that. So she'll be like a chill person there, and so that's why she's amazing, because she made us feel that we're a part of her family. Sorry. So that's her. And she's a good teacher. So for us students, like she will know what we are good at. Sometimes you don't realize that you're good at whatever, like speaking or writing or reading or whatever, but she would know that. And she would say, "Oh, you're good at that. She's good at that. Do that." And then we think, "Oh, she was right." So that's how it used to be with her. And then that was at Shankar Netralaya. And then when I went to LVPI, I had an opportunity to work with this amazing pediatric ophthalmologist, neuro-ophthalmologist, and strabismus specialist, so Ramesh K. Kanaya. I really look up to him. In fact, he's very good clinically, research-wise, and also the kind of ophthalmologist, like ethically he is. I really adore him for that. He brings in a lot of like international collaborations to India. So working under Dr. Ramesh was a very nice experience as well for the couple of years that I spent at LVPI. And then I was preparing for while I was working at LVPI, I was preparing for my PhD as well, right? So, and then Professor Brian Holden, so I got an opportunity to do PhD under him. But sadly, we lost him at the same time. And then I got an opportunity to work under Dr. Shankari Durg, so Professor Shankari Durg, but also an elite school alumni. She was my mentor for 4 years, and I tell her now that you're my mentor for life. So she's so good. I've learned under her, and then so whichever myopia research that you read about, it will either have her or as an author or as a cited author or something. So she's as you might have heard of her. So she's a myopia scientist working in the myopia space mostly. So I had a wonderful opportunity to work under her during my PhD and also a year of postdoc. She was one of the supervisors during my postdoc as well. And then finally, when I was at UNSW, I had an opportunity to work with Fiona Stapleton. She's a science chair professor now and an exemplary reader to look up to. I had an opportunity to learn from her for a year and a bit more. So it was a wonderful experience as well, and truly shaped me choose my career paths going ahead. So those are my mentors, and as I said, I'm thanking all of them, shown here and not shown as well. Okay, I'll just move on to some technical details now. So I'll just detail about my PhD research. We'll just talk about it a bit. So my PhD was done primarily at Brian Holden Vision Institute, affiliated to UNSW. So everything is in one complex, affiliated to University of New South Wales. And it was based on myopia. So there was a lot of myopia research, and I think still going on during my time, as in this. I started doing my PhD in 2016, and I've cited this paper here. So it started in 2016 and then went on. I had a maternity break, so a lot of personal changes as well in between, and then it continued up until 2019. 2020 is when I graduated. So we started calling myopia as a crisis because of its high rates of prevalence and the severity of the consequences associated with it, right? So, and we all know by now that there's this estimated projection which says that by 2050, 5 billion myopes will be there in this world. And by the same year, we're going to have 938 million high myopes. And younger the onset of myopia, more the amount of progression. So children are more likely to progress more, and more likely they can develop high or pathologic myopia. So in an otherwise normal looking optic disc or posterior segment, once you develop high or pathologic myopia, there will be a lot of changes, physiological changes. That's also vision debilitating. But the key point here is we know for a fact that there are numerous posterior segment changes that's associated with mild, moderate, or severe myopia. But most of them are happening in the posterior segment or near the optic disc area. So we thought of looking at this area a bit more specifically. So optic disc and the surrounding posterior segment areas, and see whether if we are able to pick up any subtle changes that can predict myopia. So closely monitor what are the changes happening, not at this stage where it's an atrophy or it's maculopathy or whatever, but looking at those subtle changes in children and see if we can make any predictions of onset of progression of myopia. So this was a basic theme of the postdoctoral research, and we thought we'll do that by looking at optic disc tilt. We'll look at the rotation. We'll look at some of the posterior segment changes, for example, tessellations, and we'll also look at the peripheral refraction changes. So this was the hypothesis, and we thought we'll do it with the help of 3 studies. So the first and the second one is basically pilot study, so pilot exploratory study. The first one was conducted in adults based in Sydney, Australia. And for the next 2 studies, we had international collaborations. So for the first study, adults were included. And we just wanted to explore features that are specific to myopia. So not reached a maculopathy atrophy stage, but still very specific to myopia. And the next stage, which is again a pilot study, but this time conducted in children, we did a bit more like advanced image analysis to look at the features a bit more closely and basically to refine the methods. Like, can we use the same methods for a big population-based study? Or should we change our methods? So just basically refining the methods using study 1 and study 2 pilot studies. And then basically doing a large-scale population-based study and develop a predictive model to predict the progression or onset of myopia. So this was a basic theme of my PhD research. And the first study, as I said, was conducted in adults. And then we found out that all these features, yes, they're very specific to myopia. So we evaluated these features and collected data and using the instruments that we already have readily available. But for the peripheral refraction profile alone, we used a custom-made instrument. It's BHVI made instrument only available in a couple of centers worldwide. So that's what we used. And we found that there are features that are very specific to myopia in the adults, and we can calculate them. This is basically what we found out from study 1. Now, I've not put together the entire table and the data over here, but I'm just summarizing the study 1 and study 2 details. We'll see a bit more of study 3, which may be more relevant to you. So study 2, again, we were refining methods. We're like, what are the features that we can closely monitor? So we looked at whatever study 1 variables that we found a bit more closely. So we're looking at the fundus. We're looking at how oval the disc is, how tilted it is, how rotated it is, and the tessellation. So tessellations, or the tigroid appearance of the fundus, is very common in myopia and is mostly seen like inferior temporal, superior nasal in all locations, but in varying intensity. So the intensity is different. And temporal crescent, which is the half moon sign. So this is another very classic sign of posterior segment change that happens in myopia. We looked at all of this and we analyzed this based on image J in the first study. Sorry, just skipped. So the first study, we used a tool, image J, and most of the analysis were manual, very manual. So manually doing all the analysis was not automated at all. So at this stage, when we reached the study 2, we thought that we need to automate this because for one image, we are taking around 2 minutes with the manual method, whereas for this method, it would take us, say, 30 to 40 seconds. So I'm just going to quickly show that. So here we're marking 8 points around the optic disc, and then we're marking the fovea to disc distance. So that's the purple point that you see there. And we're also marking superior and inferior retinal temporal artery and vein angles. So these are the measures. We'll see that in a bit of detail later on, but basically this is how image analysis will happen. And you'll see all of whatever you want to measure. So they had specific calculations. So these features will have specific calculations associated with individual. For example, the tilt will have a different calculations. The ovality will have a different calculation. So fovea to disc distance will have a calculation. So based on that, your values will be displayed here. And based on this technique, our measuring time reduced to a great extent. So we thought this is a good method to use for the population-based study. Now, based on this, so that's basically refining the image analysis technique. Now, based on the research itself, like what does it tell us? So we had 28 patients here, so 56 eyes, and then we checked, so all of this all of the variables that we measured, put into a general linear model, we found that there are a few features that can be predictive of baseline myopia. So by looking at just these features, we can predict what level of myopia they had. So it's basically the temporal artery angle, so where the artery meets that reference circle, and the tessellation, so mainly the nasal tessellations and the superior and temporal nasal tessellations, the fovea to disc distance, and the ovality index. So all of that put together in a model could predict the baseline myopia with a 63% of the variance. Okay, so that's the value that we got. We thought it's not a bad value. It's not a moderate value. So let's go ahead and do the progression model as well. So progression model it's giving us only a variance which is moderate. It's not as high as 64%, but it's now come down to 35% and 24% respectively. And the features of we didn't get superior temporal artery angle as a feature here that could predict progression, but we did see that the tilt or the ovality index came up and temporal crescent came up as well. So that's basically the, so this, and then one of the key features is that we predicted there was an axial length model and spherical equivalent model. So axial length will be predicted with a little better variance value than the spherical equivalent. So 35% here and 24% there. So we are still finding that there are features that can be used. Now, we need to see that. So this is just 28 eyes, and then we need to see it in a population-based study. So that's the next step. And this is basically the framework that we saw earlier. So the predictive model study, the population-based study. And for that, first thing we tested was the factors that are specific to myopia. Had 2,851 patients. They were all of Chinese ethnicity. So we partnered, or collaboration was with Shanghai Eye Diseases Treatment and Prevention Center. And so the population for this study was 2,851, aged around 8 to 13 years. And out of this population, 15% were myopes and 81%. So 81% for 2,417 patients were non-myopes. And in this population itself, when we put together all the features that we tested onto a model, we found that your minor axis, that's this one over here, and the fovea to disc distance, and the temporal crescent, and the tessellations, and the retinal nerve fiber layer, thickness difference between temporal nasal difference of the RNFO, everything contributed to this model. And we could make good prediction of factors that are specific to myopia. So when we put this under a curve, an ROC curve, this prediction could be made with an 84% probability. So that's what this population study, the title Factors Specific to Myopia, gave us. Then we'll just go back and I'll just show you the green ticks here. So the green ticks here is what we got in study 1 and 2 as well. So they're similar. There are some features that are coming up again and again. And then we have factors specific to the incidence of myopia. So for the incidence of myopia is you're watching them at the baseline, which we saw, which was a factor specific to myopia. Now, 1 year later, what's the percentage of the children who became myopic and which of them remained non-myopes? By non-myopes, I mean emmetropes or hyperopes. Now, of the non-myopes that we had, 15% remained, 15% became myopic, and the rest, 85%, remained non-myopic. And now when we look at the changes of the children who became myopic, which is the 15%, they had the similar changes. So their minor axis was smaller, and so decreased minor axis, decreased fovea to disc distance, and the RNFO temporal to nasal was more, difference was more. So all of these changes put together, we could predict this incidence with 72% probability. And then we have factors that are specific to the progression of myopia. So progression of myopia here is defined as an axial length change that was greater than 0.5 mm in a year, or a spherical equivalent change that was around approximately 0.75 diopters or more. Now in this case, like who progressed? Of the myopes, who progressed and who did not? So 45% here is whom were progressed, and 55% did not. So 45% had either axial length greater than 0.5 mm or a spherical equivalent greater than 0.75. So in this population itself, again, similar features came up. Now, what does this mean? So let's go back to incidence. So we are saying that your minor axis is getting decreased, and then your fovea to disc distance is also getting increased. Your temporal artery angle is moving away, so it's increased as well. So why is it happening? So we thought, what if there's this nasal? We know that there's mechanical pulling of the eye or the stretching of the eye when there is myopia. Now, this mechanical pulling could be nasal, it's nasally getting pulled, and this pulling is causing the fovea to disc distance to come closer. And your minor axis is also getting, because there's a stretching there, and you're seeing tessellations in that area. And now your superior artery angle. So your superior is the place where it first stretches. So nasal pulling, and then there's stretching. So this is what we thought. And coming to progression and the values that we got here, and the variables that we got here, so there's the same variables, your tilt, your temporal nerve fiber layer, your fovea to disc distance, but there's also inferior temporal retinal artery angle, which means that we thought, okay, maybe when there's onset of myopia, there's superior artery angle that is getting pulled, so superior that is getting pulled. And now there's also the inferior, when there's progression happening, there's also the inferior retinal artery angle. There's a pulling from down as well. So this is what we hypothesized. And so when we put together all these variables in a model, again, we could predict the progression of myopia with 78% probability. Now, into this model, if we add the variable axial length as well, which is axial length at the baseline, then this number shoots up to 84%. So 84% probability to predict the progression of myopia. So this is what we found, and I've just tabulated this for study 1, 2, and 3. Basically, the green ticks mean they're repeated variables, like comes up quite often. So the tessellations, the optic disc tilt, the artery angle shift, pretty much everything that's coming up in all the studies. So let's just also see it schematically. So there's tilt, there's artery angles that's going in that direction because of the nasal pulling. There's temporal more than nasal, because there's pulling in the nasal area, and then the fibers are getting all into that temporal area. And there's also pulling of the fovea to disc distance, making it smaller. So this is the gist of the project, and the research is still underway. It's still happening. Other researchers are doing it in the institute. So I'm going to now talk about the limitations as well. So now this was done in Asian eyes, not a multi-ethnic population. So the research is happening in multi-ethnic populations. We're doing a study in India as well. We, as in they're doing a study in India as well, to see if the same changes are being seen in other population as well. And of course, further research needs to be conducted in a multi-ethnic population for this to be validated and to be used as a tool to predict. And we did not include high levels of, there was no high levels of myopia here. So there was like, as I described, so this was between mild to moderate. So, and we also didn't take into account considerations like the level of astigmatism. So it was spherical equivalent, right? So that was included in the model, not the astigmatism specifically. So that was not a variable that was used. And also lens thickness, which can also affect these variables. So these were not considered in the study. A few articles and conference papers that came out of this study, and acknowledgements. I would like to acknowledge my supervisors, co-supervisors, members of the advisory panel, pretty much everyone for this project and for the guidance and support. So that was my PhD research. Now, after my PhD, I'm not in a full liberty to discuss about the projects here. It's my postdoctoral research, which is still underway. So these are conference papers, so full-length articles are still being written. So we can't discuss it more here. But then basically the topics that was researched upon was, investigating different ophthalmic lens prototypes. So lenses and filters and that can reduce, that can help with myopia control or reduce myopia progression. So this and my Mableman gland dysfunction research is was with Professor Fiona Stapleton in the dry eye space. This was my postdoctoral research. And there are a few conference papers that's out and a few more literature underway. So as I said, your personal life can influence your professional life as well. So I made a very big shift from research to a clinical application specialist now. I'm working for ZEISS. And now when you hear clinical application specialist, I'm not sure if you're very familiar with this term, because I wasn't at this point. So I read the role description and then I understood, oh, this is what it is. So I'll just explain to you what I do, okay? So as a clinical application specialist, you're specialized in one application. So in my case, it's refractive lasers. And by refractive lasers, this might be a very familiar term to you. laser technology. So LASIK, your smile surgery, your corneal refractive surgeries, basically. So you specialize in that. You specialize in the treatment planning, in the workflow. So, and then it's basically like education and training. So you learn about the technique, for you being an optometrist. So I'm an optometrist in the surgery space. So I need to first get trained about the techniques. Now, how do I get trained? I operate on pig's eye. Pig's eyes. So I operate on pig's eyes. I do it from start to end. So treatment planning and then operating, using the surgical instruments, using the surgical tools, and then operate, and then you learn, and then you train. So once you get trained, you can educate. So that's how it went about. So who are we training? So you'll train your surgeons working in the space, the nurses, the optoms, the orthoptists working in the space. So pretty much everyone who's working in that space. So these are the workflows. So there are regulatory and compliance. These are all associated with any role that you do when you work with an industry. So product launches, conducting wet labs, so all of that. So now I will show you. So this is something, we call it refractive workplace. So this is like pretty much, so you're doing a LASIK surgery, and then you want to recognize patient's iris correctly because it's a customized surgery, right? It's a customized surgery. Patient's visual axis is not same for every patient. So you need to have that accurate recognition of the iris. You capture an image with the help of ILMaster. You import it onto we call it the refractive, we call it the forum or refractive workplace. So we import it onto that. And this talks to the surgical instrument. This talks to the analyzing tool. This talks to your excimer laser. So pretty much everything is connected. So this is basically showing you the connectivity of all the surgery, all the instruments that is associated for that surgery. So you being an optometrist, being in a CAS role, we call it like clinical application specialist. So it's in short called CAS. So if you're in a CAS role, you need to know everything about these instruments and how it works and how it functions. And if it's not functioning, why is it not functioning, and things like that. So let's just see. Now there are two types of lasers, right? So in the corneal refractive space, we have your femtosecond laser or your excimer laser. So one is used to create a cut, and the other one is used to reshape your cornea. And you might have heard about smile procedures, about LASIK flap creation, about the corneal rings that's used for KC, and your ablation procedures. And there's topo-guided procedures for irregular corneas. PTK, PRK, you might be familiar with, and this is presbyond. It's for presbyopic patients. So these are the procedures, and I'm not going to get into the detail of it because certain information cannot be shared because of confidentiality unless you're a surgeon or somebody working in that space. So it's basically working on these procedures and knowing how the procedure is done, how the treatment planning is done, what can be the post-operative outcomes, doing data analysis, review, and therefore workflow optimization. So from start to the end. Okay, so those are the two lasers. So one is your femtosecond. This one will do your cutting in a very lay language, meaning initial days so the first LASIK was performed using a keratome or a blade to lift the cornea. Now this one does the job with the laser. So we call it the femtosecond. Femto meaning it will take a fraction. So 1 by 10 raised to 15. So that's how much time it would take to make one pulse. So even if you're a myope, say of -8 diopters, the laser will take like 10 seconds to make that cut. So it's that high technology, advanced technology, and it has something called swivel arms. So it just has two arms standing up. It's in the resting, but it's not in the it's not standing up right now. But we call it the swivel arms because one is a laser arm, the other one is an operating arm, and it can be standby or in the down position based on how you want it. And once you make the flap here, That's for LASIK. And then you move to the patient to the excimer laser. And now this does the ablation process. So this one, the femtosecond laser, does the photo disruption, as we call it, or it creates cavitation bubbles and therefore separates the tissues. And this one, your excimer laser, does photoablation and therefore reshapes the cornea. So that's the gist. So flap done here, ablation done here, flap reposted, LASIK procedure is performed in this way. And I'll show you a video of how the swivel arm works. So that's basically, you can bring the arm down on a click of a button. So the patient wouldn't have like a MRI kind of an experience, a closed experience. So they will have an open sky kind of an experience. So that's your Visumax and MEL 90. MEL stands for Modern Excimer Laser. And yeah, I thought I'll show you how the lasering of LASIK is done in a video here. So it's an animated video. So that's your laser. We call it the spiraling in of the laser. It spirals in. And that's a side cut. And the flap is open. That's your excimer laser. So cut made using femto, and your excimer laser does reshaping. And the flap is reposted. Now, this might be a video that you might have seen before. And this is your SMILE, or small incision lenticule extraction, which is a latest than LASIK. That's your spiraling in technique, and then you're spiraling out. And then a tiny incision is made, like a keyhole surgery, and then you can take out the lenticule, which carries your myopic refraction or your hyperopic. And the lenticule is taken out. So this procedure, anyone who is suitable for LASIK can also do SMILE. We have a range for it. As long as the eligibility is met, the patient can do SMILE. Why SMILE? Because SMILE spares the nerve. So as you saw, the side cut is not a full cut like LASIK, and we are taking the tissue in between. And therefore, there's less nerve damage, and therefore, there's less dysphotopsias like glare or halos and whatnot. So that's a bit more like visually pleasant experience, SMILE. That's me doing fixed eye surgery for the very first time. So I think that's it. Thank you all for listening.
Thank you for your insightful presentation and talk, Divya.
Thanks,
We have a couple
Gauri.
of questions in the chat box.
Okay.
There are questions from Kali Darshini Shakti. She has asked a few more questions to you.
Okay.
Like, she would like to ask you how you prepared education in India for opportunities in abroad. Followed by next question is, what are the skills and experiences should a B-Optum student focus on to excel in their career? And what advice would you give for someone like me, that is she, who aspires to grow in optometry both in India and internationally?
I think so. In terms of higher studies, if you're aiming for PhD, these days you don't have to do a research work in between. For example, you don't have to do your master's, or you don't have to do your M.Phil. Your bachelor's is sufficient for you to apply for PhD. Now, for you to be a successful candidate, it depends on how many publications you have. So you need to publish your research. So PhD is a research course purely. That's why people undertake a master. It's not a prerequisite, but people still undertake a research course, because in bachelor's, it's not in the syllabus to learn about. I'm sorry. Just an interruption here. So it's not in our syllabus to learn about research skills, or data analysis and what is research, the principles of research, how to perform. We're not taught that, and because it's not in the syllabus. So that's why you learn M.Phil or a research course, or you work in a research institute as a research optometrist, and then you work on multiple projects, and then you write and read. So as bachelors, how can you prepare for, as a bachelor of optometry student, how can you prepare for that? You can read a lot. So we used to have, like, I remember, like, when we were doing our bachelor's, we had this Optometry Today magazine in the library, and I used to like read that like crazy. So that was one of the things that we used to do. But I feel like reading a lot these days, a lot of like publicly available literature is available. So basically, reading and understanding what is research will be a good idea if you want to pursue a research related course once you pass your bachelor's. What was the second question, Gauri?
Another question is from her is, right? She asked you to share what inspired you to pursue optometry and eventually work abroad. She is very keen to understand how you navigated the path which you really love to achieve this much career
So
achievements, right?
So what I did in terms of like career, like when I was preparing for PhD, is working on basically uh, research articles, like learning about research and attending conferences and presenting in conferences. So basically everything related to research, just pretty much do that. And also talk to people, like talk to people who have um, who are your supervisors, for example, who you want to be your supervisors. For in my case, I spoke to Brian Holden directly. If you can't do that directly, and if you really like, for example, your interest is in retina now. So if your interest is in retina, you Google, there are search engines like your Scholar or your PubMed, and then you read a lot of articles, and then you figure out, okay, you want to work in that area of retina, and then you look at the universities where they're doing that kind of research, or professors who have undertaken that kind of research, and the research articles will have their email IDs. So ask them if they're looking for PhD students based on the credentials that you have. So if you have presented in conferences, say I've presented in this conference, or my work was in this retinal project, I would like to work with you, and send your CV across. And that's one way of doing it. Or you apply to universities directly with the application form without the support of the supervisor, but you can apply for scholarships. So that's another way. So you can directly apply for scholarships as well. I hope that answered the question.
Then another question from Ritika. What are the difficulties you had faced in your journey?
Difficulties?
Same
Yeah,
question
it's
from
not a
Sabareason also. What
sorry.
challenges do Indians face? Another question from Sabareason related to
Okay.
the same question. Challenges do Indians face after moving to Australia like this?
Challenges
In your
is
journey,
that
these challenges.
like if I can be very open, so in the movies it shows like it's all like hunky dory, and then they're all singing songs and things like that. So we have an impression of a certain living when we go abroad, but we miss the reality of not having that support system. So we're moving. For me, the thing was that I studied in one place. So I'm from Kerala. I've lived in Coimbatore, Chennai, Hyderabad, and a few days a few months in Delhi as well. And then I moved to Sydney. So I lived independently in different places. But for some people, it's just that when first time you're out of India, you lose that support system. In India, you have your friends and family and then whatnot. But when you move alone to a new place, you have to understand that culture. You are starting from scratch, so you form your relationships with your, like, you have new friends, and it takes time for all of that. I feel that's one thing. And that's personally. And professionally, I think when you're Working culture is slightly different in Australia. In terms of the working hours itself is comparatively like lesser. But if you're a researcher, you work day and night. That's another thing. But for other professions, I think there's working hours might be slightly less, and you need to understand the working culture a bit more, which you will understand when you're here in different. Australia might be different, and US might be different, India might be different. So each place will have their own working culture. Yeah. So those are a few things that you can think about when you're moving from one country to another. And also your language skills. Yeah. And there was a second
Next
question.
question.
Yeah.
Yeah, tell me, Divya.
It was about, I think, difficulties in terms of like what difficulty are you specifically asking for? What kind of, if you want to be like specific.
If it seems about job seeking as well as pursuing education, I think everything is included in this difficulties.
Um,
How to
I
get the
think
guidance,
job
likewise.
search, it's just that you have to look out for opportunities and keep applying. Like it's not like you think that you want to work with this supervisor and then you get that supervisor to work. It's not like that, right? So you have to keep applying for different opportunities, and then you will understand the application process and how you can go about it. So it's just a process. So like any other, like it's competitive. It's a very competitive field for, like, for example, imagine like we're from India, but then there's other students all over the globe applying for good universities under good professors for good scholarships. So it's a very competitive field. So you have to make a lot, understand how the application process for different institutions, take a lot of help online, and then pretty much keep doing it. And once you do a lot of it, you will now know what to do. So that's one thing. So keep applying. And if you're getting rejected once, don't stop. Like if that's your question, like if you're getting rejected, don't stop. Just keep applying, keep talking to people, and then keep listening to talks, keep reading, and just keep doing your stuff. That's all.
Then another question from Kenishra. The earnings and expenses can be manageable.
Sorry?
The earnings and expenses can be manageable when
So
you
if you're
pursue.
if you're coming, so if you're doing a PhD, for example, I can talk based on my experience. So if you're coming for PhD, I would not recommend you to do a PhD without a scholarship support. Okay, that way you're a student, you don't have any income with you, and you'll be taking relying on like loans and stuff to study. I personally will not advise that. It will be difficult. I think it will have its own consequences. I would say if you apply for scholarship and then you get the scholarship, that's the most ideal way to do your PhD. If you have a PhD scholarship, you get your tuition fees sorted. So your tuition fee is taken care of. Plus, the scholarship will include a living stipend. It won't be like a salary package, but it will be enough for you to live in Australia. So that's how scholarships work. And some scholarships pay you just about that money for you to live in Australia, and then your tuition fees are taken care of. If you're academically more competent, you will be getting scholarships that can be equivalent to a starting salary package in Australia or elsewhere. So it depends what kind of scholarships you'll get. I strongly feel like if you're like going abroad for studies, having a scholarship is the best option. That way you don't have to repay your loans and then work during your studentship, you might have to take up extra jobs and things like that, which can affect your studies. So I personally feel like having a scholarship will be handy.
Then another question from Mirudula. What are the skills do companies like ZEISS look for an optometrist entering industry roles?
What are the skills that they look for? Firstly, you have to be skilled. I think you have to be in the eye space. You have to be either an optometrist um, or orthoptist working in that space. For example, I am a CAS working in refractive laser area. Let's imagine there's a CAS working in cataract surgery area. So if it is cataract surgery, the requirement will be that you should understand the procedure. You might have observed a few cataract surgeries and you know how the calculations are made. You can talk to people, so your communication skills should be good. Um, and so you're skilled in your communications, and then I think that's what they will mainly look at. If you're equipped well, like if your skill sets would match, I think that's what they will probably look at. Yeah.
Yeah, thank you, Divya.
Thank you.
Due to time aspect, I would like to thank Dr. Divya ma'am for your time and this consideration. Thank you. Thank you. So before we close, I just posted today's quiz link in the chat box. After filling this, you will be able to get OCI certification with 2 credit points, which is signed by both Acchutha and OCI. Do fill and submit it to get the certification. Thank you, Dr. Divya ma'am, and everyone for the good time.
Thank you, Gauri. Thank
Thank
you
you,
for
Divya.
organizing this, Gauri and Shamla, ma'am.
Thank you so much.
Thank you.
Thank you, ma'am. Thank you.
Thank you.